Canada, one of the world's most developed economies. But behind the soaring towers and bustling streets, a hidden crisis unfolds. A quarter of Canadian households struggle with food insecurity. That means 1 in 4 families can't always afford enough to eat. And for many, it doesn't stop there. Every night, 35,000 Canadians have no home. Over a year, that number swells to nearly 250,000 people navigating homelessness. Homelessness in Canada isn't random. It follows lines of systemic inequality. 1 in 20 Canadians, just 5%, is Indigenous. But among the homeless population, that number jumps to 7 in 20, or 35%. About 10% of Canadian youths identify as LGBTQ2S+. But among homeless youth, it's as high as 40%. Life starts with a lottery ticket. Some grow up in loving, stable homes. Others enter the child welfare system, foster care, group homes, child protection services. 3 in 5 homeless youth have experienced the child welfare system. The general public almost never uses the system. The question is, how do we break the cycle? For women fleeing domestic violence, the next crisis is finding shelter. Many are full. Others have shut down. Half of the women seeking refuge bring children with them. The majority, 71%, are turned away because there's just no space. When safety isn't guaranteed, what happens next? They should just get a job. They didn't work hard enough in school. It's what some people say when they see a homeless person on the street. But the data tells a different story. A 2021 Toronto Street Needs assessment found that 42% of surveyed homeless individuals have post-secondary education, bachelor's degrees, even masters. Surveys done in British Columbia in 2020 showed that 43% of their income is from employment, some working full-time, others piecing together side gigs and informal jobs like bottle collecting and vending. And even then, it's getting harder to find and keep jobs. In Toronto, employment income among homeless individuals has dropped sharply, from 29% in 2009 to just 9% in 2021. A minimum wage job should cover the basics, but across Canada, the numbers don't add up. The hourly wage required to afford rent, without spending more than 30% of income on housing, far exceeds minimum wages. Affordable 1-bedroom units, just 7% of neighborhoods have them. For 2 bedrooms, that number drops to 3%. As of 2022, in Toronto and Vancouver, the average wage needed for a 1-bedroom apartment was $33 an hour. The minimum wage, just $15.50. That means even 2 full-time minimum wage workers can't afford a 1-bedroom unit. And if that's not precarious enough, consider this. Between 21% and 42% of one-person households, that's 1 to 2 in every 5, have an annual income at or below what a full-time minimum wage worker earns. This means a significant portion of the population is at high risk of poverty, often forced to make impossible choices between basic necessities like food, heating, and rent. Canada's social rental housing stock sits at just 3.5%, less than half the OECD average of 7.1%. Compare that to the Netherlands, 34%, and Austria, 23%. 250,000 households are on the waiting list for social or affordable housing. In Toronto, the wait time for a 1-bedroom subsidized unit stretches up to 14 years. Studies in Toronto show that homelessness isn't just about having no place to sleep. It's a public health emergency. Compared to housed individuals, homeless individuals have significantly higher rates of physical and mental problems across the board. The homeless population have double to quadruple the rates of chronic lung disease, asthma, liver disease, stroke, chronic neurological disorder, and history of COVID-19 infection. 5 times the rate of HIV/AIDS, 7 times the rate of mental health, and 25 times the rate of having over 7 emergency visits to the hospital per year, compared to the housed population. The longer someone remains homeless, the worse it gets. Higher risks of trauma, substance use, and declining mental health. It's a downward spiral that's incredibly difficult to escape. Studies in Toronto found that, on average, homelessness reduces a man's lifespan by 1/3 and a woman's by half. This means homelessness affects women more severely. While the average housed person reaches about 81 years old, A homeless person only reaches about 48. Here's the paradox. It costs more to ignore homelessness than to fix it. Homelessness costs the Canadian economy an estimated $10 billion annually, driven by healthcare, emergency shelters, law enforcement, and social services. In Toronto, a homeless individual costs the healthcare system $12,000 per year, compared to just under $2,000 for a housed person. In Montreal, the cost of services for a single homeless person with mental illness reaches $60,000 per year. Studies in Halifax and British Columbia show a clear alternative. Investing in social housing reduces public spending on homelessness by 41 to 48%. Applied nationwide, that's a savings of $4.1 billion to $4.8 billion for taxpayers. In 2017, Canada launched its National Housing Strategy, NHS, a $115 billion plan to tackle the country's housing crisis. The goal: reduce chronic homelessness by half before 2028. Some initiatives are progressing well, particularly efforts to repair and preserve existing social housing. But other critical areas, such as expanding rent-assisted units and increasing support through the Canada Housing Benefit, are lagging behind. While there has been notable progress, there are issues and challenges that dampen the effort. New housing construction remains significantly slower than expected, due to lengthy planning, permitting delays, and challenges in coordinating with provincial and local governments. Compared to private housing, social housing is costly, slow to develop, and progress often stalls due to changing political priorities, inconsistent funding, or reduced commitments. Rising material costs and labor shortages have further exacerbated these delays. A past focus on homebuyer support rather than boosting affordable housing supply. The outcome: housing remains unaffordable and the supply of social housing remains scarce. Not all parts of Canada face the crisis in the same way. Ontario and British Columbia lead in housing development, but other regions, Quebec, the Northern Territories, and the Prairies, face much tougher obstacles. Materials and skilled labor are more expensive, especially in remote areas. Vast distances and harsh winters make construction difficult. Many areas in the north and prairies have limited road access, especially in winter. Extreme cold, permafrost, and short construction seasons make building and maintaining homes more challenging. When there are challenges, there are also solutions. Since the inception of NHS, the government has continuously prioritized feedbacks and adapted its strategy to significant disruptions, such as the COVID-19 pandemic. There's no single fix, but there are proven solutions. To reduce lengthy wait times and speed up development, the government is actively working on streamlining permitting and approvals, reducing bureaucratic red tape, and strengthening intergovernmental coordination. To secure long-term funding, they are enforcing multi-year commitments for social housing, introducing housing bonds or trust funds for dedicated financing, expanding inclusionary zoning, requiring developers to allocate a portion of their project to affordable housing, encouraging public-private partnerships to attract long-term private investment. To control rising material costs, the government is strengthening key trade partnerships and increasing domestic production of essential materials. To address the labor shortage, they are working on upskilling Canadian workers, raising wages for in-demand skills, and implementing targeted temporary visas for skilled trade and healthcare workers. The recent shift in the National Housing Strategy, focusing on affordable housing supplies, is an essential step in tackling chronic homelessness. For Quebec, the Northern Territories, and the Prairies, the regions that face more obstacles, there are solutions that the government is implementing to curb these issues. Prefabricated and modular homes to reduce costs and speed up construction. Encouraging the use of locally available materials such as timber in northern and prairie regions to reduce transportation costs. Targeted incentives, subsidies, and public-private partnerships to encourage developers and incentivize private companies to co-invest in these projects. And other innovative financing models, such as introducing rent-to-own programs to make homeownership more accessible. On the other hand, residents can collectively buy and manage land through community land trusts, CLTs, to make housing permanently affordable. To overcome logistical difficulties, the government is Investing in transportation and infrastructure, such as expanding all-season roads, ice roads, and shipping routes to improve access for materials and labor. Establishing regional warehouses in remote areas to cut down costs and delays. And seasonal planning, maximizing construction during warmer months and stockpiling materials before winter to avoid costly midwinter deliveries. To tackle climate-related challenges, developers are incorporating innovative building techniques such as permafrost-resistant foundations, high insulation materials, and passive heating, using energy-efficient and sustainable options such as solar panels, wind energy, and geothermal heating, retrofitting older buildings with better insulation and heating solutions, and ensuring homes are suitable for multi-generational living. Rural communities hold untapped economic potential. Home to just 20% of the population, they contribute 30% of the country's GDP, driven by sectors such as mining, forestry, agriculture, fisheries, energy resource extraction, and electricity production. Despite spanning 98% of Canada's landmass, only 1 in 5 Canadians lives in rural areas. There is a growing problem: workforce leakage. A shrinking workforce is one of the most pressing issues for rural communities. Sectors like construction, manufacturing, retail, and healthcare desperately need workers. But as retirement rates soar and young talent moves to cities, rural labor gaps are widening. Immigration offers a potential fix, yet most newcomers settle in urban centers due to job concentration, better settlement programs, and existing cultural communities. For rural regions to compete, they must become places where people want to live, not just work. Rural Ontario bears a disproportionate burden of the province-wide healthcare crisis. The overcrowding of emergency departments, the ongoing shortage of healthcare workers, especially primary care physicians, and the scarcity of mental health services are felt most deeply in rural areas. A staggering 65% of municipal representatives say residents don't have access to walk-in clinics. Additionally, 60% report that their community lacks mental health and addiction support. Rural residents without access to a family physician or a family health team is increasing 4 times more rapidly than in urban areas. There is a need to address these critical issues as well as to expand community paramedics program. Housing is another crisis in the making. 1 in 4 rural residents, or 24%, cannot find affordable, quality rental housing, a figure that is double the national average. Few private developers invest in rural markets, limiting options for low-income families. There are also extra challenges faced by families with children living in rural or remote locations, including limited access to childcare services. In many areas, parents are forced to cut back on work or travel long distances to find daycare. A digital economy is impossible without reliable, high-speed internet. Yet, in 2019, less than half of rural households had high-speed internet access, compared to near-universal coverage in urban areas. Poor mobile connectivity is a safety risk. It puts people in situations where, if needed, they have no means to call for help. This continues to be perilous for Indigenous women and girls who, without public transportation, rely on hitchhiking to travel between communities. Thankfully, the government has made available over $7 billion for the Universal Broadband Fund, UBF, with aims to connect all Canadians to high-speed internet by 2030. If you live in rural Canada, public transportation options are often limited. Essential services like grocery stores, healthcare facilities, and schools are often spread out across large distances. Most jobs in rural areas are likely to require driving to reach the workplace. This poses a significant challenge for people who can't afford a car or when the only car in their household breaks down. In addition, expanding transportation infrastructure, such as roads, air, and rail, as well as intercommunity transit, can unlock economic potential by facilitating tourism, expanding job opportunities, and building stronger commercial supply chains. Energy supply and infrastructure needs to be in place to support housing and economic growth. The AMO, Association of Municipalities of Ontario, reports that the province needs to double its energy capacity over the next 25 years. Energy expansion will also create jobs for the region. With the right strategies and incentives, affordable housing and rural development can create profitable long-term opportunities for developers. investors and corporations while generating valuable, sustainable assets. The Department of Finance Canada reported in 2024 that bold strategies are in place to unlock 3.87 million new homes by 2031. The federal government's plan provides incentives for all levels of government, as well as for private and non-profit sector partners, to build more homes, make homeownership or renting easier, and assist Canadians who cannot afford a home. In 2021, some of Canada's largest financial institutions announced substantial commitments to invest in housing affordability. Both Scotiabank and the Bank of Montreal revealed plans to mobilize $22 billion in total financing over the next 10 years. In fact, investing in affordable housing can actually attract investors and boost local job creation in Canada, curb the healthcare crisis, end homelessness, and transform our economy. Here's the equation. When developers build affordable housing, workers stay. When workers stay, businesses grow. When businesses grow, investors flood in. When investment flows, jobs are created, which adds economical and political incentives to build roads, infrastructure. As movements of goods and tourism ease, it grows the rural tourism business. As individuals have accumulated income, homelessness ends. Investing in affordable housing across Canada isn't a humanitarian effort. They are keys to transforming our economy. The community plays a crucial role in advocacy, co-op housing, and grassroots initiatives that keep housing projects moving forward. Community groups can hold politicians accountable for maintaining NHS funding and preventing cuts, while also advocating for zoning reforms that encourage higher density, mixed-income developments integrating social housing. Skilled individuals can donate or offer pro bono services to social housing projects and related consultancy. And community programs can help new social housing residents with job training, financial literacy, and social services. The engagement of civil society has been a crucial factor in the achievements of the National Housing Strategy. Together, a unified, intensified effort from all sectors of the community, from government bodies to developers, private sectors, and the public community, we can make Canada a stable, prosperous home for all.